Welcome back to the Hampton Road Show. Cosmetic surgical procedures such as facelifts and eyelid surgery aren't anything new, but they're definitely not a public topic of conversation for most people. Today we have Dr. Jonathan Jacobs of Associates in Plastic Surgery joining us to answer our questions about facial rejuvenation and how surgical procedures can restore a more youthful appearance while also providing some functional benefit. Dr. Jacobs, welcome to the Hampton Road Show.
Well, thank you very much.
Okay, so we've heard about standard facelifts and mini facelifts, lower facelifts, etc. How many types of facelifts are there, and can they make a big difference?
There are lots of facelifts for different people, and they're very personal operations. You know, they're not the standard cookie cutter operation. They're an operation that's designed specifically for whatever the patient's needs are or what their perceived needs are. So we tailor them very, very personally and specifically to the patient.
So a patient comes in and says, this is what I would like, this is what I'm looking to do, and that's when you come in with the answers.
And the patient comes in and says, this is what I've noticed happened over the last few years.
Right.
What can we do to reverse that process? And then we have a whole litany of things that we can go through to make those corrections.
And how much younger will it make a patient look? What can they expect?
Yeah, I think that most people think 10 to 15 years. I think that's realistic. And I think most of us think the procedures last for 10 to 15 years in regard to slowing down or reversing the aging process.
And we talked about the facelift and the eyelid surgery as well.
Mm-hmm.
These are two different procedures. Should they be done at the same time or maybe scheduled at a different time?
They're frequently done at the same time. It affords the patient the opportunity to have one recovery period. They don't have to be done at the same time, and sometimes there are insurance issues that cause us to do them at different times. That being that very frequently the correction of the upper eyelid allows for better vision, and so that becomes an insurance event, and sometimes we alter that the timing to affect that.
There are a lot of patients out there or people who are looking at themselves and saying, you know what, maybe I can benefit from this. What do you tell them about the procedures and what should they expect?
We usually go through the type of procedure they're going to have done, the length of time they would expect to be down, where the incisions would be made, and what they could expect to look like. We have ways of making predictions for them in regard to their appearance after a surgery, and we give them a good idea of where they will be after it's all over.
And Dr. Jacobs, I'm sure when people do have the procedure and later down the line, they're probably thrilled. I'm sure you've got some great stories to share about what it makes and what kind of difference it makes for your patients.
And you know what's so, for us, on our side of this, fun about this kind of facial surgery is that it's very personal. This is the, I want to look my best for the wedding pictures that are coming up in 2 months kind of patient who shares that portion of what's going on in their lives with us. This is exciting for us, and this makes our job even more fun.
In 10 to 15 years, that's a big difference.
Oh, it's huge.
Yeah, Dr. Jacobs, thank you so much for
Thank
joining
you.
us today. Once again, Associates in Plastic Surgery, located at 1037 First Colonial Road in Virginia Beach, also at 844 Kempsville Road, Suite 102 in Norfolk. You can find out more at associatesplasticsurgery.com, or you can call 757-491-3535.